ROI is often associated with only hard data or quantitative data, but we also want to look at qualitative data from staff surveys, focus groups, and any other employee listening exercises. They are equally valid because the proxy measure of happiness demonstrates that they are equally valid. A good colleague of mine, Jan Emmanuel Deneve, professor at Oxford University, was able to show that employees who are happy at work were 13% more productive. And that Oxford's research design was not just a correlational study, but had strong elements of an intervention-led study. So it's more powerful than pure correlation.
Hello, and welcome to the Mental Health Advantage podcast, where we talk to business leaders shaping the future of workplace mental health. Today, I'm honored to be joined by my friend, Dr. Wolfgang Seidl, partner and workplace health consultant leader at Mercer. Wolfgang, how are you today?
I'm very well. Thank you so much for having me. I'm really looking forward to that discussion because normally we do it in private and we always get so much out of it. So I'm curious how it will work with a big audience.
Yeah, I know we're going to have a lot of fun. So let's hop in. So you've worked across medicine, psychiatry, corporate consulting. What drew you originally to the intersection of business and mental health?
Well, it's interesting. I always see you as a great psychologist, whatever your background is, Stephen. And it takes someone like you to draw out these nuggets because you are right. I have always been a curious researcher and always looked for more depth and context. That's why I love interdisciplinary subjects, like I studied psychiatry, philosophy, and society after graduating from medical school. And as an academic, I taught subjects like brain and behavior or return on investment of mental health in the workplace. So to answer your question more simply, one day a headhunter just turned up and said, Mercer is looking for a doctor with substantial business experience, and I only know you who has got that kind of combination. So that's how I landed there. And 14 years as a partner at Mercer later, I still love it as much as I did on day one, finding new avenues to make the case for what I would call a data-driven and purposeful health and well-being strategy.
Well, let's talk about that. That's a good place to double click in. So when you and I spoke about the Mental Health Advantage book, you said, and I quote, raising awareness is important, but it's not enough. We need to measure impact, track engagement, and embed mental health into business strategy. So much there. So let's start with something that is going to feel fairly obvious to people, but I think you're going to give a nuanced answer to it, which is, why is measurement critical when it comes to workplace mental health?
Yeah, that quote sounded so much better when you read it, Stephen. But I would say it is critical because what gets measured gets done, particularly with regards to mental health. People often assume it is difficult to grasp, a bit different, a bit out there, and a bit scary for some or fascinating for others. So let me pour cold water on that. ISO brought out a new standard just a couple of years ago called ISO 45003, Psychological Health and Safety at Work Guidelines for Managing Psychosocial Risks, I think they call it. And the best part about it is that it has been written in the same boring fashion as any other ISO standard, to be auditable on a very practical level. All of our listeners who have gone through such audit process know that I'm talking about a cumbersome process. But I promote the standard in the following way, because I say it proves that we are now looking at mental health on a parity with physical health. That's quite something. And that is reflected in the fact that it uses the same lingo. And beyond that, I think it's obvious. A good emotional well-being at work leads to better business outcomes. And that's measurable as productivity, as performance, as ROI, as VOI, whatever you want to call it.
Yeah, well, I love that because, one of the things that we talk about at Journey, part of our mission is how do we make mental health as understood and accepted as physical health? Somebody shows up to the office with a broken leg. Nobody's wondering what the issue is, right? So nobody's embarrassed to be able to say my leg is broken. But if you have depression or anxiety or anything like that, you might not feel comfortable to share that with your colleagues or your manager. You might have to hide it. And so creating an environment where mental health is as understood as physical health, not just in the workplace, but in the world, is really important. And I love the fact that if you think about ISO, right, it's standardizing processes and procedures and outputs in a way that's very, to your point, very measurable, right? So much less soft and squishy. And so, let's talk a little bit about that. So, what frameworks or KPIs should companies use to assess mental health initiatives? Of course, some may say we want to go with something more formal like an ISO, but others may say we're just dipping our toe in the water. So, can you give us a range of different options there?
Oh, that would be a pleasure. I mean, I have done that for so many years, and I think it's really important that you measure. And everyone starts with utilization, and that's okay. Although I often call it the lowest form of wit, with reference to Oscar Wilde's bon mot about sarcasm. However, without utilization, there is no ROI, which takes us to how the program is being promoted and so on and so forth. But back to headline KPIs that you mentioned. For me, in that environment I work in, I'm privileged to have access to a number of data sets, health insurance claims, absence data, presenteeism data, which of course overlaps with the all-important productivity data. We can talk about that later, perhaps. Staff turnover, or the intention to leave, as we call it in some pieces of research. That's sort of a similar item, a proxy measure. We can measure burnout rates. We can measure compliance and litigation costs, engagement, or even happiness levels. Well-defined ones, of course, but as you know, it's becoming more and more popular to sort of check in on happiness on a daily basis. So you see, on the one hand, ROI is often associated with only hard data or quantitative data, but we also want to look at qualitative data from staff surveys, focus groups, and any other employee listening exercises. They are equally valid because the proxy measure of happiness demonstrates that they are equally valid. A good colleague of mine, Jan Emmanuel Deneve, professor at Oxford University, was able to show that employees who are happy at work were 13% more productive, and that Oxford's research design was not just a correlational study, but had strong elements of an intervention-led study. So it's more powerful than pure correlation. But if I may change gear now, after having rattled off so many quantitative measurements, there's of course another metric that is often forgotten, but a metric that I feel strongly about as a clinician. And that's clinical outcomes. Did we actually achieve anything in making people's mental health experience better in that intervention? In other words, are the tools in our toolbox sharp enough to improve the health of our clients? Because if they are not, any ROI is at best spurious. If it's done correctly, a good mental health pathway, as I call it, where various services are meaningfully connected and stakeholders refer to each other and outcomes are measured with empirically validated tools, achieves a lot. For instance, in an organization that already had everything that money can buy in terms of employee health care, we were able to achieve, after creating a mental health pathway, still a 16% reduction in average cost of claims, or 41% reduction in mental health related absences, and 60% improvement in therapy outcomes. That's what really matters. And given that we didn't plug in any new costly service, but just made current provision work better, these ROI figures are even more impressive.
For sure. I'm going to go a little bit off script here and ask you a question. I feel like since I'm here, I may as well get some free advice. Although there's no such thing as free advice, so I should be careful what I ask for. So one of the challenges that we have is we've done a number of clinical studies. So we had one with Humana that showed that when employees had access to Journey, absenteeism was reduced by 51%. Right? They showed up to work more often because they had support. We had another clinical study that showed when employees had access to Journey, they hit the health plan less. So employers saved $580 per engaged employee in healthcare costs. And obviously, this all makes sense to me and to you. And when I go to companies, they say, well, okay, so when you put Journey in place at our company, how are we going to measure the results? And one of the challenges that we have is obviously there's a lot of factors that impact these things outside of journey, outside of the company, right? If you think about what's going on in the world nowadays,
Yes.
you think about everything that's happening in people's lives. And so my question to you is, as an HR leader, if an HR leader came to you and said, we're evaluating this benefit and we want to know if it's really going to work for us, would you recommend rolling it out to everybody and comparing 2025 versus 2024? Would you say roll it out to half the population, to have a treatment group and a control group and compare those two? Would you think about it in some other way? So I'm curious how you would think about that.
Well, that's an interesting question. I mean, I normally, when I do health dashboards, I ask for data sets from the last 3 years, actually, to have a substantial piece of information in there. And I don't always ask for all the data sets that I rattled off to you earlier on, because most people don't have them. Particularly organizations are quite embarrassed about the state of their absence data, and they shouldn't be, because when you then triangulate these data sets with others, the direction of travel usually tends to be the same. So that's the impressive part of looking at more than one variable. So I normally say at least 3 data sets would be useful. So that's one thing in terms of looking at big, robust data sets over 3 years. Of course, you could have a trial run on people, and you could draw a comparison between one group that has the intervention and another group that doesn't have the intervention. I mean, it's still not a randomized controlled trial, but it is something that is a bit more scientific, if you like. So they can do that. Ethically speaking, do you necessarily need to waste time on that? Yes, if you feel you can, then by all means do it. But on the other hand, the benefit of services like yours, mental health services, EAP type services, come from the fact that they are being rolled out in an equitable fashion. So you don't want to withhold it from other people, but you can, of course, do that. There's other ways of doing it. You can use qualitative surveys at the end. Most of those mental health companies call it evaluation forms, but they are just customer satisfaction forms normally, because nothing else is in there other than, were you comfortable with the room in which you sat, or the lighting, or the tea and sympathy that you received from your counselor. But you could ask better questions related to presenteeism in comparison to my sort of absence rate before I had that intervention with you. I had so and so many days off, and now I'm having only fewer days off. Or you could say, in comparison to my best performance, how do I rate my current level of productivity? Stuff like that. That sounds very down to earth, and that's why it's good. But it has been empirically validated if you just look at questions of that sort in terms of the Stanford presenteeism scale, for instance.
Yeah, that's super helpful, because I know that HR, for the most part, almost every HR leader I've ever spoken to, like, their heart is in the right place, right? And then they have to say, how do I make the business case? And we help them by saying, well, look at what we've shown, in the lab with organizations, right? But it was a clinical study, a little bit different than, it's in the wild and we're now unleashing it on all, 25,000 of your employees. So I think having those additional options to think through is really helpful. Let's transition a little bit. So one thing that we've all been talking about probably for a long time, I'm sure you've probably been talking about it far, far longer, is this idea of psychological safety, right? There was the big Google study a long time ago. And, there's an expression in leadership, like, by the time you're tired of talking about it, that's when people first start hearing it. So for me, I feel like I've been talking about this for a long time. And at the same time, I'm like, okay, maybe now leaders are starting to hear it. So one of the things that you said is, and I quote, a truly mentally healthy organization is one where employees feel safe speaking up, not just about stress or burnout, but about everyday challenges in the workplace. So how can organizations foster psychologically safe cultures and psychological safety at all levels?
Well, it's such a beautiful concept, isn't it? I think we both gravitate towards that concept. So we probably need to define it just very briefly in the sense of how Amy Edmondson at Harvard Business School developed it. Psychological safety as a progressive concept, not just to make sure that people don't get psychologically injured. That's different. That falls into the ISO 45003. But in Amy's opinion or definition, it would be more about a team climate that is safe for interpersonal risk taking, where we can learn from each other and invest our ideas and ultimately make a difference at work because of who we are. And the absence or presence of psychological safety is part of workplace culture. So that defines the workplace culture in which I operate. And we know from other studies, particularly a study I was involved in that we published together with BITC, that King Charles's Trust, and McKinsey was involved as well. We found that workplace culture has the biggest bearing on everyday well-being at work out of all the factors. So in some studies, it's up to 60%. Now, if it's a culture issue, it starts from the top. Leaders must role model that it's okay to speak up and to be yourself. And otherwise, you're actually shortchanging your organization by not investing what you have to offer. And we know that, a diverse workforce is so much better at problem solving than a monolithic workforce. So that's just on the side. And that's why I love Amy's concept so much, because for the first time when she published that, I realized what it meant bringing your whole self to work which was a little bit of a superficial phrase in the past, but now it is filled with meaning. And so if it is a culture issue, then it does start from the top. A lot of health behavior change starts from the bottom, but culture change tends to start from the top. And leaders, as I said, must role model that it's okay to speak up, but also then for employees from the bottom up, from as a grassroots movement, if you like, to uphold the value of psychological safety. That then takes a dynamic in its own right. And as everything, a lot of this can be taught, though. Just like empathy, that most people think is something we are born with. Yet studies show that people with low levels of empathy benefit most from training. And, I shared a platform with Stephen Covey once where he asked 500 company directors how many thought that their people reached their full potential. And only a dozen of hands went up. And the follow-up question was, but how many of you had more than 2 days training in advanced empathy skills? So I think that's really important. And to hammer home that message, if you allow me just one more sentence, really, I sort of love delivering this type of conversation to C-suites these days and talk to them about psychological safety. And that triggers a lot of culture change in organizations that then cascades to managers and ultimately to all colleague training in the end.
Yeah, I love that. When I talk to HR leaders, one of our core philosophical pillars is that the benefits are just the start. The culture has to support mental health, because you can plug in Journey or any of our competitors or any great benefit. And if the culture is one where employees don't feel seen and cared for, there isn't psychological safety, there isn't permission, managers aren't trained, it's just not going to work, right? Like the body is going to reject it, right? And so we have to start there. And so let's talk about that a little bit. What are some specific things? You mentioned empathy training. What are some other specific things that I'll actually parse out two things. You can group them together if you want. Executives and managers, right? We work with a lot of companies that have 25,000 employees, which means, there's a C-suite and there's senior leadership, but then there's also thousands of managers, right? And you've heard the old expression, right? People don't quit companies, they quit managers. And managers nowadays are being asked to do more with less. And so I guess a long way of saying, what are some thoughts, whether it's for executives or managers, on what they can do to increase psychological safety?
Yeah, that is a very good question, really. And I think a very important one. I learned over the years that being a manager is so much more than being technically competent. And yet people get promoted on the basis of their technical competencies and not necessarily at all. They get promoted because they are able to lead people. So that is a starting point, I suppose. And it should be part of the assessment of managers, that they are knowledgeable about the well-being of their colleagues, not in an intrusive way, not to mutate into a counselor, but it's not too much to ask that you know roughly where people are and that you are able to spot the early warning signs of troubled employees and have the necessary basic empathy skills, which can be learned in a matter of hours. It doesn't even take days to learn the basic empathy skills, that you can relate to your people. And then you just need to be cognizant of the right referral mechanisms. That will be music to your ear, I guess, that you then need to know where is that mental health service, where is that EAP, where is something where I can discharge my duty of care that I have as a manager. And in doing that, you are setting the tone and lead by example in such a way that you are ultimately helping in reducing the stigma. And even more so, if you ask me to pull in the C-suite conversation here as well, because they are often perceived as being disconnected from people on the shop floor, as it were. And we find that often in those staff surveys, engagement surveys, that colleagues say, okay, my manager is quite all right, but the C-suite doesn't even know who I am, doesn't understand me. And then people have prejudices against them. So I find working with C-suite and senior leaders is fascinating and much more rewarding than people think, because they have just been waiting to be asked, to be honest, and they have their own ideas what makes for a high productive culture that is psychologically safe, and how they have spotted some unease amongst their colleagues but didn't dare to speak out. And then they are very keen on a follow-up training that I call managing for high performance. But just as I mentioned this one, I'm reminded, actually, I had no intention of saying that to you. You know what's the most popular training that I get asked to deliver again and again and again? And that's for all employees. And that is sort of culturally bringing them on board. And I call the training Stress, Resilience, and Psychology of Happiness, from Kung Fu Panda to the Meaning of Life. That's something that people can relate to, and there is no problem starting to participate in this type of training.
I love that. It reminds me, one of our early advisors. So Journey next week actually will be 10 years old. So we've been at this for a decade. Thank you. Time flies. One of our early advisors was a Harvard professor named Tal Ben Shahar, and he's written a number of books on happiness. And he taught a class that was the most popular class at Harvard. And interesting to see how happiness and resilience touch each other in the workplace, because teaching the idea of how to be happy is actually something that you would think would be more common in a workplace, because, to your point earlier, right, studies have shown if you're happy, you're going to be more engaged, you're going to be more productive, you're probably going to stick around longer. But we shy away from stuff like that, right? Like there's a stigma around the idea of talking about happiness at work. And so it's interesting how it's touched in resilience training, which obviously has been around for a long time. So anyway, no particular point there other than just thinking about how happiness has to find its place in the workplace. I don't know if that's a bridge too far, but I guess I'm curious your thoughts on that.
Well, it's an interesting one. People, when they hear that just as a sentence, happiness training and so on, some people think it sounds very self-indulgent, but that's not what it means. We really have to reflect on what we mean by it and how closely it is related to purpose, my purpose to come to the fore so that I can thrive in the workplace. If I thrive, I will just have feelings of happiness as a side effect. We know from delivering psychology of happiness training, and I know that training very well that you referred to from Harvard, and we know that if you sort of pursue happiness as the only goal, you will fail. Happiness is more like a side effect of many activities that you can do. And then it becomes easier for people to relate to them, the purpose of your organization. What is your own purpose? What makes your heart sing, as Steve Jobs would have put it? And that, I think, is helping people ultimately to realize how important work is in their life. And then, of course, the other side that Freud always mentions, work and love. What else is there? Those are the two things that matter very much. And if you look at happiness in this very constructive way and not in a self-indulgent way, then I think it becomes clear to people that we are talking about a purpose. Yes, there's a lot of purpose washing. So this beautiful concept has been diluted a little bit. So I tend to call more about making a contribution, that is very similar to purpose. It's based in what is important to me and my negotiation of meaning with the organization. What's the organizational purpose and what is mine, and how can I make a contribution? Then it becomes an active process, a non-self-indulgent, a non-passive process where I can really thrive, leave a legacy, and have all the benefits that come from having good work.
I absolutely love that. I think that's the best I've ever heard somebody put words to that, especially nowadays because there's so much conflicting advice, especially for young people about, find your purpose, pursue your purpose, and then how does that meet the reality of the work world, of what's needed for you and your own financial, sustainability and things like that. And I think going back to the happiness point, here in the States at least, happiness has sort of an artificial sweetener, like a saccharin sort of thing to it, like drink a Coca-Cola and it'll make you happy, versus what we're talking about, which is more of a deep-rooted satisfaction that comes from a lot of different components. So anywho, let's transition to one other topic, which is embedding well-being into business strategy. So not simply being an HR issue. So you said, and I quote, mental health isn't an HR issue, it's a business performance issue. When well-being is embedded into company culture, the ROI becomes clear. Well said. So how should companies align mental health strategies with their overall business goals?
Yeah, again, trying to be precise for a change, I would say via the productivity and performance angle. We have the research evidence that happy employees are more productive. You and I just talked about that at length. And engagement leads to high performance, and people who have really thought about, reflected on their purpose in the current situation they are in, will ultimately be more engaged and more productive. I think in that sense, you want to integrate mental health strategies in everything you do. And my dream would be that ultimately you are not just putting across fairly artificial or contrived programs that people can see through, but that mental wellness and respect for human beings is an automatic side effect of the way how we do business with each other. I often hear, oh, yes, we would love to do more training, but we don't have time for it. Oh, we would love to give more feedback to our employees because we know from other pieces of research that if people get constructive feedback, they're much more engaged. If you ignore them, they're very disengaged. But then I'm saying to people, well, if you don't have time for it, just interact with your colleagues in the part of your as part of your job in a way that's respectful and enhances mental health. I personally prefer that actually to somebody coming up to me and making it very contrived.
So when you think about the executive suite, what are the biggest challenges in getting CEOs, and I would say perhaps even more importantly, CFOs, to prioritize mental well-being in the workplace?
I suppose they are used to numbers, so a good business case always helps, doesn't it? And so once you have established your credibility by showing that you really understand your numbers, then other very important conversations follow, but not before that usually. And those conversations may then resonate much more on an emotional level, and hence a value of investment type of conversation takes place. And very often you just need to use your own empathy skills to relate to CEOs and CFOs. And I have found that very often when I do that, they tell me about their personal angle or their personal experience even. And I recently suggested in a think tank that I'm part of that we are not asking health and well-being leaders to tell us what the business case should look like, but that we have CFO roundtables. And that was very enlightening because CFOs for the first time had to put pen to paper and tell us how they make their decisions when they either authorize or don't authorize a well-being program. And it will not surprise you that if you work long enough with them, their decision making is based on very similar assumptions that you and I or well-being directors would be using. But it was important to listen to their voice.
Well, I think I love that exercise because I think asking them to come up with the answer is very different than just presenting. And that's what I often see, right, is HR is trying to make the business case, but they don't know what target they're trying to hit. So they might be saying absenteeism is reduced or turnover is reduced, or we're reducing the healthcare plan. And sometimes the CFOs care, sometimes they don't. One other thing that I found is oftentimes action is taken when there's a personal story that jolts people into action. So as much as, to your point, and I always, we have an ROI calculator, we do a whole bunch of things to help HR make the business case. What I'll often see is the decision to make a change and improve the mental health benefits will often come from a story of a person having some type of traumatic experience. Hey, this person, this 20-year, vet of ours lost their husband, and they reached out to try to get support, and they waited 5 weeks and they didn't get anything, and ... right? And then when it personalizes it and humanizes it, that might jolt somebody into action, where sometimes the numbers, their numbers on a page, they look at it and they sort of fall flat. So I think that combination of both can be important. I'm looking at the time here, and as per usual, we have more to talk about than we have time. So let me ask you this. Looking ahead, what are the biggest changes that you see coming to workplace well-being over the next, let's call it 5 or 10 years?
Well, I think that we are witnessing professionalization of health and well-being programs that are more targeted, where more critical questions are being asked about the evidence base of the intervention. Don't tell me, please, that's just wishful thinking. I want to believe it. And that will make a big difference. The other one, of course, that everyone is thinking of, quite rightly so, is AI, 100%. Huge impact of AI. I'm a person whose glass is always 3/4 full, actually. So I see the positive sides, the upsides of AI that will help us with a lot of things that we are doing. I also believe that what's on the horizon is that Gen Z has an impact on our way of thinking, and it's about time, because I always like the provocations coming from Gen Z, particularly on work-life questions and flexible working and so on. I think you said it often before as well. I guess we understand a little bit better the holistic models nowadays, that it's not either, bodies without souls, or other people with souls but no bodies. That's how our hospitals have been structured. But we know that there's a healthy mind in a healthy body. And I was just in Asia in the last week, working with a very interesting employee population who had a lot of challenges because of the mental health challenges, because of the work they are doing. And, and they were surprised when I told them that part of the strategy of dealing with mental health can also be to burn off some of your stress hormones. And someone said to me, "Oh, I didn't even know that hormones have anything to do with stress, right?" So that was quite interesting. So healthy mind, healthy body is really, really important. And ultimately, the appreciation of the social well-being and the workplace culture that we started to talk about at the beginning of our session will be more and more important. I mean, not forgetting, of course, very practical questions like accessibility. So I probably gave you a little bit more than you wanted to hear, but all those things are happening right now and will be happening more in the future, I believe.
Yeah, absolutely. And I think separate from the workplace, what you talked about in terms of stress hormones, when I was in school, and I went to a New York City public school, and it gave me a great education. But the things that we learned were much more facts and figures about the world and history and the dinosaurs and, all that, versus how to manage everything going on in here and in here. And my hope is that we start to look at the education that we're giving to people, so that as we're growing up, we're learning much more about how we work and how we operate and how we move through the world, because being a human being is a interesting experience, And so I think the more we can embed that, whether with chips or, just teaching people early on, I think the better. So that's not so much a prediction of workplace mental health, but more an aspiration for our future together.
Indeed.
So always a pleasure, Wolfgang. Another incredible discussion. I wish we had 2 more hours. Your work at Mercer and beyond is helping companies to rethink mental health. I always appreciate you taking time to share with me your insights, your perspectives. So thank you very much. It has been an absolute pleasure.
Huge pleasure being with you and with our audience. And if my answers were any good, then they were only good because of your good questions.
Thank you. Thank you. For those of you listening, if you enjoyed today's episode, please subscribe, rate, leave a review. We'd love to hear from you. This has been the Mental Health Advantage. Have a beautiful day.